Hi, this is Holly Kirby. I will be doing my comprehensive physical examination for N5130. Hi there, how are you?
I'm good.
My name's Holly Kirby. I'm a student nurse practitioner and I will be doing your examination today. Can you tell me your first name and how old you are?
Casey and 21.
Great. And do you consent to this assessment?
Yes.
Okay, so patient state's name is Casey, 21-year-old Caucasian female, appears stated age, and I will be performing a comprehensive physical examination today. I will be looking, listening, and feeling at various points throughout the assessment. So if you have any questions or if anything causes you discomfort, please let me know.
Okay.
First, can you tell me your date of birth, what today's date is, and where we are now?
10/30/1998. It is April 17th, and we are in Georgetown, Texas.
Okay, great. And how would you rate your mood overall?
Good.
Okay. So patient appears alert and oriented to person, place, and time. Well-groomed, pleasant, cooperative, good eye contact, communicates effectively, reports mood as good, congruent affect. Okay, now I'm just going to check your skin out. Skin is warm, dry, skin turgor with instant recoil, fair in color, mild acne noted, no other lesions noted. Let me check your nails. Okay. And if I can have you, I'm going to check your base angle one at a time. Great. Thank you. Okay. And check for capillary refill. Your toes. Okay, great. So nails firmly adhered, pink in color, symmetric, bilaterally. Nail base angles at 160 degrees, no cyanosis, clubbing, pitting, or edema is present. Capillary refill is less than 2 seconds on upper and lower extremities. Now let me check your hair. Any tenderness?
No.
Okay. So fine, soft, terminal dark brown hair, clean without infestations, no lesions, masses, scalp non-tender to palpation, no masses or lesions. Okay, great. Now when we look at your head and your neck, head normocephalic, round, midline, upright, and still no tremors or tics noted. Facial features symmetric bilaterally. I'm going to listen to your thyroid with the bell. The bell is used to hear low-pitched frequency sounds, and the diaphragm is used to hear higher-pitched frequencies. While I'm here, I'm going to do the carotid artery, the carotid pulses one at a time. Okay, and I'm going to palpate them one at a time. Okay, so, and I'm going to check your thyroid. I'm going to have you take a sip of water and don't drink until I ask you to. Okay. trachea, midline, thyroid and cartilage moves while swallowing, thyroid smooth without masses, no bruise noted. Carotid pulses 2+ out of 4+ bilaterally, no bruise or thrills noted. Okay, now we're going to do your lymph nodes. So we'll start with the occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular, epitrochlear, and let me get some gloves on real quick for your axillary. I apologize, my allergies are bad today. Okay. Great. Okay. So lymph nodes, the occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior and cervical, anterior and posterior cervical, supraclavicular, epitrochlear, and axillary lymph nodes, non-tender and non-palpable bilaterally. Throw that away. Now we're going to do your eyes. So there are 2 eye charts that are used to assess eyes. The first one is Snellen. It is used to assess far vision. Patients are asked to read a chart from a 20-foot distance. The Rosenbaum is for near vision, and it is patients are asked to read an eye chart from a distance of 14 inches. We will be doing that one later. Now I'm just gonna look at your eyes and feel. Okay, and if you can look up for me, great. Okay. So eyelids symmetric, eyelashes and eyebrows evenly distributed, eyeballs firm, conjunctiva clear, lenses clear, irises are blue, sclera is white, and lacrimal apparatus is soft and free from erythema or exudate bilaterally. Okay, now we're going to do the ophthalmoscope. So I'm going to assess your right eye with my right eye. And for purposes of the video, we won't be turning the lights off, but normally we would dim the lights for this. So I'm going to start at your eyebrow and move in. Okay, and we'll do the other side. Okay, thank you. Sorry to blind you. So ophthalmoscope evaluation reveals red reflex bilaterally, optic disc with well-defined margins, retina red, no AV nicking, exudate or hemorrhages noted bilaterally. Now we're going to do the Perla, and I'm going to use a separator vision card here. So I'm going to ask you to focus on a stationary object out front. Okay. And the first time I'm going to assess your left eye. I'm going to assess to see if it constricts. Okay, great. And the second time I'm seeing if the right eye is consensual. Great. Okay. So now I'm going to do the right eye. Right eye constricts. Right eye one more time. Left eye is consensual. Okay. And for accommodation, I'm going to ask you to focus on the pen light while I move it closer to your nose. Great. Okay. So pupils equal, reactive, 2 millimeters equal and reactive to light and accommodation with direct and consensual response bilaterally. And now we're going to do the corneal light reflex. I'm just going to shine the light at your nose and make sure it's symmetrical, reflect symmetrically. Okay. So corneal light reflexes symmetrically, bilaterally. And now we're going to do the cover uncover. So I'm just going to cover your right eye and remove it. Make sure there's no wiggle or nystagmus. And do it again to the left eye. No wiggle or nystagmus noted. Now we'll do the 6 cardinal fields. So I'll ask you to focus on the pen light without moving your head and just focus with your eyes. So I'll do left superior, left lateral, left inferior, right superior, right lateral, right inferior. Okay, great. So I already did the corneal light reflex. Okay, so the cranial nerve 3, which is oculomotor, cranial nerve 4, which is trochlear, and cranial nerve 6, which is abducens, all motor are intact as evidenced by a patient is able to complete the 6 cardinal fields of Gay without deviation or nystagmus. Cover uncover test without deviation or nystagmus, and corneal light reflexes symmetrical bilaterally. Okay, so now we're going to do the ears. First, I'm going to inspect this position and the outside, and then the mastoid process. Any tenderness?
No.
Okay. So, pinna in alignment with eye canthus bilaterally, no nodules or masses palpated, mastoid processes non-tender, no masses or inflammation noted. So now I'm going to look at the inside of your ear with an otoscope. And I'm going to brace while I'm doing this. Okay. And microscope evaluation reveals canals free from erythema or cerumen. Tympanic membranes pearly gray. Bony landmarks intact. Right cone of light at 5 o'clock. Left cone of light at 7 o'clock. No bulging or retraction. No perforations bilaterally. Okay. Now we're going to do the Wren and Weber test. Or actually, the auditory acuity test. So I'm going to stand behind you about 2 feet and I'm going to whisper something, and if you'll repeat what you whisper and cover your, put a hand on your ear, please. Okay? Yeah.
99.
Okay, and we'll do it on this side.
Chocolate.
Okay. Great. So auditory acuity intact as evidenced by patient is able to hear whispered words from 2 feet distance. That also checks cranial nerve 8, which is acoustic, vestibulocochlear, sensory nerve. So now we'll do the Wren and Weber test. So first I'm going to put this on the top of your head and let me know if you perceive it in both ears.
Yes.
Okay. And now I'm going to place it on the mastoid process behind your ear. Timing, when you stop hearing it, let me know, and I'm going to move it to the outside of your ear and let me know when you stop hearing it then.
Okay. Okay.
Alright, and we'll do the other ear.
Okay. Okay.
Okay. Great. So, Weber test revealed vibrations perceived bilaterally or lateralized bilaterally. Air conduction is greater than bone conduction in both ears bilaterally. Okay, so then let's do the nose. Just gonna look at the outside of your nose. Okay. Nose midline. Can I close the nostril? Can you breathe out of that? And this side. Okay. Patent bilaterally. And then we're gonna look inside your nose. Bracing. Okay. So, nasal mucosa pink and moist without lesions, erythema, polyps, or edema. And now we'll do your sinuses. I'll do your frontal. Let me know if you have any tenderness.
Okay.
And your maxillary. Any tenderness?
No.
Okay. And then if I can have you close your eyes and open your mouth for me. I'm going to do a transillumination on your maxillary sinuses. So frontal and maxillary sinuses, non-tender, bilaterally with palpation, maxillary transillumination without occlusion. Okay, so then we'll do your mouth and throat. And get some gloves. So lips are pink and moist. Okay, open your mouth for me. Get my pin light. Just gonna feel around. Count your teeth. And can you say ah for me? Stick your tongue out and say ah. Okay. Thank you. Okay, so buccal mucosa pink, moist, without lesions. 28 white teeth with braces to upper and lower teeth. Tongue dull red, moist, moves symmetrically. Oral or pharynx, pink and moist without lesions or exudate. Tonsils 1+ out of 4+ bilaterally. Cranial nerve 9, which is, goodness, I just forgot which nerve that is. Hypoglossal, no, not hypoglossal, something glossal, and vagus, glossopharyngeal, yes. So cranial nerve 9, glossopharyngeal, and cranial nerve 10, vagus, cranial nerves, sensory and motor intact, as evidenced by soft palate and uvula rise upon phonation. Okay, so now we're gonna do your lungs. So I'm just gonna inspect your chest. And if you can say 99 every time you feel me touch you.
99, 99, 99, 99, 99.
Okay, so no tactile fremitus noted. And I'm just going to do some percussion. So, and check respiration rate for 60 seconds. Chest skin is smooth, warm to touch, symmetric. AP to transverse diameter is 1 to 2. Respiration rate 14 breaths per minute, even and unlabored. And now let me listen to you. Starting with the trachea and larynx. bronchial breath sounds auscultated over the trachea and larynx. Expiratory is greater than inspiratory. Bronchovesicular sounds at the second, right, and left intercostal space. Expiratory equals inspiratory. Vesicular breath sounds over the lung periphery. Inspiratory is greater than expiratory. All lungs sounds clear to auscultation without adventitious sounds anterior, posteriorly, and laterally. Okay, now we're going to do your heart. The heart has to be assessed in 3 positions: sitting forward, supine, and left lateral recumbent. And we also auscultate with the bell and the diaphragm. Again, the bell is used to auscultate low-pitched sounds, and the diaphragm is used to assess higher frequency sounds. So we're just gonna inspect first for any pulsations, heaves, or thrusts, and palpate the precordium and the apical pulse. Okay, and then I'm gonna start with the diaphragm at the aortic, second intercostal, right sternal border, the pulmonic, the herbs, tricuspid, mitral. Count pulse for 60 seconds. And yes, I'm underneath the clothing. Okay, so heart rate 92 beats per minute, regular rhythm and rate, without rubs, murmurs, gallops, or splits. And we'll do it again using the bell. So we've got the aortic, second intercostal, right of sternal border, S2 is greater than S1. The pulmonic, second intercostal, left sternal border, S2 is greater than S1. Got herbs point, third intercostal, left sternal border, S2 is equal to S1. We have the tricuspid, fourth intercostal, left lower sternal border, S1 is greater than S2. And the mitral, which is also the PMI and apical, S1 is greater than S2. Regular rhythm rate. Now we're going to do your pulse, your blood vessels. So I'm going to check your temporal, brachial, radial, posterior tibialis, and dorsalis pedis. So all pulses 2+ out of 4+ regular rhythm and rate. Now we will do the abdomen. If I can have you lay on the couch for me. Okay, so I'm just gonna look at the abdomen. It's symmetrical. I don't see any venous patterns. No lesions. Skin is cool, dry to touch. I'm gonna listen to you first. So active vowel sounds times all 4 quadrants and epigastric region. I'm going to percuss now. Okay. So tympani noted to 4 quadrants and epigastric region. And now I'm going to find your liver, which should be the 5th midclavicular line, and what I'm going to do is measure that. So, and then your spleen is over here, 6th to 10th mid-axillary line. Do you have any tenderness there?
No.
Okay. So, splenic dullness noted to the 6th through 10th intercostal mid-axillary line. Liver span is 6 centimeters, no hepatomegaly noted. And for the sign, I can't remember what. Anyway. And if I can have you sit up, or actually, let me palpate. First, I'll do light palpation. Any tenderness?
No.
And deep palpation. Any tenderness?
No.
Okay. And I'll have you sit up and we'll do the CVA tenderness. Any tenderness?
No.
Okay. So, no CVA tenderness noted. We'll do your musculoskeletal system now. If I can have you stand up and I'll check your posture and gait and walk across the room for me. Great. Okay. And so posture is erect, gait is steady. Now do the scoliosis check. I'm gonna have you bend towards your knees and then rise slowly while I check your back. Okay, I'm looking from front and side. No evidence of scoliosis. Patient was able to bend down towards toes, rise slowly without curvature. Okay. Now, let me have you sit down. Now we'll do active and passive range of motion. We'll start with your ankles. So I'm gonna have you do plantar flexion, which is down towards the ground, dorsal flexion up, and then inversion, it's in sweep, and then eversion is out sweep. Okay, can you do that again by yourself? Okay, and then we'll do your cervical spine. So this is extension, we'll do flexion, head down, extension, hyperextension, and then we'll do right lateral bending and left lateral bending. And can you do that again by yourself? Great, thank you. Now we'll do your shoulders. You can put your arms out and across, and then back. Arms behind your back. Sorry.
This one.
And then arms behind your head. Okay, and if you'll do that again for me. Okay, thank you. And then we'll do wrists. Up, down, wave towards your thumb, and so that was medial deviation, this is ulnar deviation. Okay. Okay, great. So full range of motion with active and passive range of motion in ankles bilaterally, cervical range of motion intact, shoulder range of motion intact, and wrist range of motion intact. So now, let's see, what else are we gonna do? What else? I think we're up to the neurological. So, cranial nerve 2, which is optic, which is a sensory nerve. We're gonna do the Rosenbaum. So I'm gonna place this 14 inches from you. Okay, and if you can read the bottom line for me
428739.
and cover your right eye
428739.
and then cover your left eye.
428739.
Glad you can read that, but I can't. So OD, optic, cranial nerve 2 optic intact as evidenced by OD, OU, and OS 2020 upon test. We've already checked cranial nerve 3, 4, and 6, so now we'll do cranial nerve 5. For this one, I'm going to ask you to clench your jaw for me. I'm just going to palpate. Okay, so you've got good good contraction. And then I'm gonna ask you to let me know if you feel sharp or dull sensation by closing your eyes.
Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay. So cranial nerve 5, which is trigeminal, which is sensory and motor, is intact as evidenced by contraction of the sternocleidomastoid, and patient is able to perceive dull and sharp sensations to forehead, cheeks, and chin bilaterally. Cranial nerve 7, which is the facial nerve, which is sensory and motor. Can I have you smile for me, frown for me, and puff your cheeks out? Okay. And do you have any issues with taste?
No.
Okay. So cranial nerve 7, facial intact as evidenced by patient is able to smile, frown, puff cheeks out bilaterally. We did cranial nerve 8. We tested earlier, but we're also going to test again using, if you can stand up for me, put your arms out to your side and close your eyes for 20 seconds. Okay, so cranial nerve 8, acoustic vestibulocochlear, sensory intact as evidenced by Romberg performed with no swaying noted, and patient also hears whispered words from 2 feet distance. Cranial nerve 9 and 10, which is the glossopharyngeal and the vagus nerve, were intact as previously tested. Cranial nerve 11, the spinal accessory, which is motor. Can you shrug your shoulders for me against pressure? Okay, and turn your head against pressure, and again. Okay, so cranial nerve 11, spinal accessory nerve intact as evidenced by good contraction of muscle in the trapezius and the sternocleidomastoid bilaterally. Cranial nerve 12, which is the hypoglossal, which is motor. Can you put your tongue in your cheek while I put pressure? Okay, and then on this side. Okay, so hypoglossal cranial nerve 12 intact as evidenced by strength is apparent bilaterally upon assessment. So we did the nerves. So then we do your coordination. So if you can flip your hands, your palms up and down for me on your lap real quick. Great. Okay. And then if you can put your arms out to your side and close your eyes and touch your toes and all, not touch your toes, touch your nose and alternate. Okay, great. So patient's coordination is intact as evidenced by patients able to complete rapid rhythmic movement, alternating palms up and down, and also finger to nose, smooth movements noted. Now we'll do the sensations. Take the paper clip again. Let me know, close your eyes and let me know if you sense dull or sharp sensation.
Sharp. Dull. Dull. Sharp. Dull. Dull.
Okay. And then we'll do the vibration and close your eyes and let me know if you sense the vibration on bony prominences.
Yes. 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 Yes.
Okay. So sensation intact as evidenced by patient is able to perceive sharp and dull bilaterally upper and lower extremities, and vibration perceived to upper and lower bony prominences bilaterally. So now we do the deep tendon reflexes. So we do the brachial, I just lost the name of it. Let your arm hang. Let your arm hang. There you go. Brachial radialis. Okay. And patellar. If you let your legs hang. And the Achilles. And then the plantar Babinski. Okay, so all deep tendon reflexes intact. I need to do the drawer test. They're gonna be laid down again for me. And bend this knee. Okay, and I'm just gonna pull your leg towards me and let me know if that causes you any pain.
No.
Okay, and we'll do the other leg.
No.
Okay, thank you. Alright, I think that is it. I'm sure I have missed something somewhere. I appreciate your time. Thank you very much for participating.
Thank you.
And have a wonderful day. Thank you.